Today we will talk about precancerous pathology of the cervix and cervical cancer. Also about the risk factors, treatment, and prevention of these conditions. The main discussion objects of the present lecture are epidemiology of the cervical pathology, nosology and the classification of the pathological conditions of the cervix, anatomy and physiology of the cervix, review of the most common cervical disease, diagnosis and treatment of precancerous conditions of the cervix, all about cervical cancer, prevention and screening of the cervical pathology. Cervical pathology is the second among the most common pathologies of the female genitalia. Despite a sufficient well-organized screening program, there is no positive trend towards a decrease in the frequency of precancerous processes of this localization. According to some data, in 2015, the rate of cervical morbidity was approximately 5.2%. Over the past 10 years, the increase in the incidence of cervical cancer was about 24.5%, and the overall mortality rate was 4.8%. As you see, it's quite big numbers, and it's a problem even at the present time. And although there are a great variety of different diagnostic tools and also the screening programs that are directed to the prevention of these conditions, cervical cancer is the most common second cause for the feminine mortality from the genital cancer. If today we do not carry out timely procedures for the prevention and treatment of cervical cancer, then to 2050, about 1 million of women will suffer from cervical cancer annually. Let's talk about the nosology of the cervical pathologies. Precancerous pathologies of the cervix are the changes in the vaginal part of the cervix, in which the normal structure of the surface epithelium remains, that is the physiologic mitotic division of epithelial cells. Their differentiation of maturation and exfoliation occurs. One of the precancerous conditions of the cervix is dysplasia, which is presented by the focal single or multiple pathological processes characterized with hyperplasia, proliferation, impaired differentiation of maturation, and rejection of epithelial cells that does not extend beyond the basal membrane. That means that there are two groups of the cervical pathologies. It's benign cervical pathologies and precancerous cervical pathologies that may lead to the development of the cervical cancer. In the first case, at the case of benign cervical pathologies, the surface epithelium remains in its physiological conditions, but the other group, the group that named precancerous conditions, and mostly is the different degree of dysplasia, they may lead to the development of the cervical cancer, and they characterizes with changes in the normal physiological processes that happens in the surface epithelium into the pathological conditions. Let's talk about the anatomy and the physiology of the cervix. Physiologically, women of reproductive age have cervix of a cylindrical shape, and adolescent girls have cervix of a conical shape. Wall of the cervix is presented with dense connective tissue, consists of collagen and elastin fibers with bundles of smooth muscle fibers amongst. If previously it was considered that the cervix consists about the circular muscles, but it was proved that the cervix is presented by the connective tissue, and the amount of the smooth muscle bundles inside this cervical tissue doesn't exceed 20%. The length of the vaginal part of the cervix is about 2-3 centimeters, and the thickness is about 1 to 1.2 centimeters. It is covered by non-keratinized stratified squamous epithelium, which undergoes cyclical changes during the menstrual cycle. And the cervix is covered by cylindrical glandular epithelium, which consists of 4 layers of cells. It's a basalis, parabasalis, intermediate, and superficial. And this structure of epithelium played the great role in the development of the precancerous and pathological conditions of the cervix. And disintegration of these cells and disorganization of these cells are the the pathological changes in their normal process of proliferation and apoptosis perform the basis and essence of these cervical pathologies. Superficial layer consists of 12 to 18 lines of mitotically inert cells containing glycogen and undergoes desquamation depending on the phase of menstrual cycle. Healthy cells, they are rich with glycogen, but the pathological changed cells, they are poor with glycogen, and it's one of the indicators in the diagnosis of the cervical pathology. We will talk about this a little bit later. Cervical canal is a fusiform and located between internal and external cervical os. It is covered by cylindrical epithelium and is called endocervix. The main function of endocervix is secretory because there are a lot of small glands that produces cervical mucus. The joint area between endo and ectocervix during the reproductive period lies on the level of external cervical os and is called transformation zone. Usually, vast amount of pathological processes localize in this zone. Here, on the picture, we can see the structure of the cervix. It's the cervix, it's the ectocervix, or vaginal part of the cervix. This vaginal part is covered by non-keratinized stratified squamous epithelium. And endocervix. It's a cervical canal, and as you see, it's covered by the glandular cylindric epithelium. This is the image of the cervix of woman of the reproductive age. Second picture, the same woman during the menopause. We can see that it decreases in the size, and we also see atrophic processes. Nabothian cysts. Here in the pictures, let's return back. We can see Nabothian cyst. What does it mean? It's a presentation and proof of the metaplasia on the cervical surface. That means that the transformation zone was located in a little bit larger diameter of the ectocervix, and it gradually returned to its normal place on the border of endo and ectocervix. We can see clearly this transformation zone. And the presence of this Nabothian cysts is the proof of the transformation of glandular epithelium to the stratified squamous epithelium. How it's happened? Sometimes in the early reproductive age, also in women during the pregnancy, or some women that intake combined oral contraceptives, this glandular epithelium may extend over the ectocervix, and we call this condition ectopia. We'll talk about this later. After that, and especially in women close to menopause, this glandular epithelium gradually returns to its normal physiological place that located inside the cervical canal. And in place of previously glandular epithelium that's replaced by the squamous stratified epithelium, the kind of closed glands may have appearance of cysts. Previously, cervical glands that located in this area, they covered by the surface stratified epithelium, and the produced mucus remained under this coverage. And that's why Nabotian cysts develop. This is benign condition. And sometimes, very often, it doesn't require any treatment. What are the risk factors for the developing of the cervical pathology? First of all, it's inflammatory processes of genitalia, which lead to necrobiosis and desquamation of multilayered flat epithelium of the cervix with developing of the defects on its surface. It's a traumatic impairment of the cervix as a result of vaginal birth, abortion, which occur after violation of the tissue trophism and innervation, hormonal changes, increase of gonadotropic function, and increase in levels of estradiol and 17-catesteroids, immunological impairment, and mostly increase in the level of cytotoxic T lymphocytes, decrease in amount of Langerhans cells of the cervix. Sexual activity. Early onset of sexual life and great number of sexual partners are the one of the main risk factors for the developing of cervical pathology because of the high incidence of contamination with the human papillomavirus that was proved as the only etiological factor in developing of cervical cancer. Involuntary changes of genitalia, reduced body resistance, hormonal and metabolic changes, such metabolic disease as diabetes mellitus or different endocrinological pathologies, insulin resistance, obesity, they are also the risk factors for the developing of cervical pathology. Combined oral contraceptives with a high concentration of gestagens. And, of course, smoking. Smoking is one of the predisposing factors for the developing of pathological conditions of the cervix. Hereditary factor, also one of the main contributors. If there were cases of cervical cancer or precancerous pathologies in the generations, it also increases the risk for the developing of cervical pathology in next generations. Etiopathophysiciology. What can we say about the etiopatology of the cervical disorders? Of course, the central role plays the human papillomavirus, and it plays really very big role in the development of most of cervical pathologies. Viral particles enter the human organism, in particular into the basal cells through the micro damages, usually at time of sexual contact. At least amount of copies in the basal layer, there is almost no possibility to virus identification. And we call this period latent period. During the normal speculum examination or even during the just observational colposcopy, we can see no any pathological changes over the cervix. But further expression of the virus subclinical and after clinical stages of the disease develop. Precancerous cervical pathology develops on the background of benign impairments of multilayered stratified epithelium. These such pathological conditions as ectopia and metaplasia. There are two pathways for ectopia development. First one is the development of the glandular cylindrical epithelium instead of the stratified epithelium of the cervical surface from the reserve cells. It's the main pathway of the pathophysiology of the cervical pathological processes. And the second pathway is the replacement of the mechanical defects of erosion, for example, of stratified epithelium of the inflammatory or traumatic region by the cylindrical epithelium of the endocervix. Metaplasia is the process of transformation of the cylindrical epithelial cells to the stratified squamous epithelium. Squamous cells metaplasia is linked to the proliferation of reserve cells and is the way of developing of this Nabotian cyst that we discussed a little bit earlier. Clinical morphological classification of the cervical pathology. Here we will discuss and review the most common cervical pathologies that develops as a result of different pathological processes. Exocervicitis or endocervicitis, it's as we see, they may be acute or chronic, and they develop as a result of inflammatory processes. Cervical endometriosis, polyp of the cervical canal, erosion and ectropion of the cervix, cervical intraepithelial lesion or cervical dysplasia, and depending on the severity of the cervical dysplasia, we can distinguish scene 1, scene 2, and scene 3. Other non-inflammatory cervical pathology, such as leukoplakia, cervical adhesions, stenosis, cervical insufficiency, hypertrophy of the cervix, condyloma, and congenital abnormalities and deformities. These are most common pathological conditions that we can observe during the examination of the cervix. Ectopia. Ectopia is a transport of the cylindrical epithelium of the cervical canal on the squamous epithelium of the vaginal part of the cervix. There are two types of ectopia: congenital ectopia, that is exist from the birth of the girl, and acquired. Acquired ectopia usually develops as a result of different processes, mostly physiological processes in the female organism, such as increased level of estrogens, combined oral contraceptives intake, and pregnancy. Formation and preservation of ectopia may be considered as physiological process during such a state as pregnancy, puberty, and cock intake. As we discuss it, incidence of ectopia is about 8 to 38%. In 67% of cases, ectopia develops in the early and in 10% in the late reproductive periods. Usually close to menopause, the incidence of ectopia dramatically decreases, because cylindrical epithelium remains inside its normal physiological place, and the physiological place for the glandular epithelium is the cervical canal. Clinical symptoms: mucous vaginal discharge, contact or intercyclic bloody discharge, but very often this pathology is symptomatic and can be diagnosed as a routine gynecological examination. At the speculum examination, there is a vivid red area of the various size and the shape, and usually located around the external cervical os and surrounded by pale pink mucosa, which bleeds easily at the contact. Here we can see the picture of ectopia, please. We can see ectocervix. It has a pale pink coloration. It's a physiological color of the cervix. And on this background, we can see the vivid red area of the ectopia, and we can see transformation zone between these two types of epithelium. And this may be similar, the appearance of ectopia may be very similar to the erosion, but on the examination by colposcopy, we will see the difference between the erosion and ectopia. We can clearly see the glandular structure of this area, and this is cylindrical epithelium of the cervical canal. And ectopia, as we say, can be physiological in the different periods of the female life. Also, we can see naboting cysts, and it's a proof that ectopia, the diameter of ectopia was larger, and it's gradually was replaced by the stratified squamous epithelium. We can also see the small openings of the glands, and maybe they will also covered by the stratified epithelium or remained open. True erosion. True erosion is the real defect of the squamous epithelium of the vaginal part of the cervix. Estimated that true erosion develops as a result of the inflammatory processes, which lead to the necrobiosis of the stratified squamous epithelium in the acidic environment of the vagina. At the mechanical trauma, damaged epithelium shreds from the underlying membrane. True erosion may persist during 2-3 days to 1 to 2 weeks and has appearance of vivid red area on colposcopy. You can see it looks like an ectopia, and it also have the vivid red appearance. But on close examination, especially colposcopic examination, we will see that it will not have a glandular structure, and it differs from the cylindrical epithelium of the cervical canal. It's a real defect of the stratified squamous epithelium as a result of pathological exposure. One of the most common pathologies of the cervix is the leukoplakia. What is the leukoplakia? Leukoplakia of the cervix, it's come from the Greek word white spot, is an area of a local processes of keratinization of the stratified squamous epithelium of a various degree of severity. It's parakeratosis, hyperkeratosis, acanthosis, with the formation of lymphohistiocytic infiltrates around the blood vessels of the underlying stroma. There are two types of leukoplakia: simple leukoplakia and proliferative leukoplakia with cellular atypia, and this is estimated as one of the precancerous processes. This pathology is asymptomatic and has no any symptoms, and we can diagnose leukoplakia during the routine vaginal examination or colposcopy. We can see this leukoplakia as a little bit prominent white structure and may locate in any part of ectocervix and characterized by hyperkeratosis of this area. Polyps of the cervical canal. They are connective tissue outgrowth covered with epithelium. Polypectomy is performed under control of hysteroscopy. What is this? We can see cervix, it's the ectocervix, and this is cervical canal, and we can see two polyps that are growing from the cervical canal. And they are reddish usually because they have the same structure as the epithelium of endocervix, so they have glandular structure. Here, just images of the cervix with the polyps, and we can see polyps that grow from the endocervix. There are following types of polyps: simple polyp, glandular or glandular fibrous formations without proliferative changes, and adenomatous polyps. They are glandular structures with proliferative activity. Sometimes cervical polyps undergo secondary changes, circulatory violations without inflammatory reaction, following with stromal edema and stagnation in the blood vessels, which bleeds very easily during the sexual contact. Polyps with dysplasia are precancerous pathology. And cervical cancer, cancer of the not squamous epithelium, but of the glandular epithelium, may develop from these small polyps with dysplasia. Papilloma, cervical papilloma. In this picture, we can clearly see the prominent structure over the ectocervix, and it develops as a result of human papillomavirus, usually of non-oncogenic types, with developing of these papillomas that have the exophyte growth. The focal growth of the stratified squamous epithelium with signs of keratosis. Clinically, papilloma has no symptoms. This is a rare type of cervical pathology. At speculum examination, there are papillomatous growths in the shape of rosettes, which are similar to exophytic type of cervical cancer. It usually has pink or whitish coloration and bordered from the surrounding tissue. Papillomas undergo malignization in very rare cases. So mostly these papillomas are benign pathology of the cervix. Cervical endometriosis is also one of the most common pathologies of the cervix, and usually they are a result of the trauma of the cervical mucosa at vaginal examination or treatment, and lead to development of a condition for implantation of the endometrial cells, which form the foci of subepithelial endometriosis. What is endometriosis? You are familiar with this pathology, and this is the growth and development of the endometrial tissue outside the endometrial cavity. It's a chronic progressive disease of the female genitals, and this endometrial tissue or endometrial foci, they may develop almost in all the tissues and organs of the body, and usually they are benign, but sometimes they have some characteristic of the malignant tumors because they are prone to dissemination and implantation as such kind of metastasis. And one of the organs which are often affected by the endometriosis is the cervix. Clinical symptoms It's a complaint on pre- and post-menstrual bloody discharge of a chocolate color, dull pain in the lower abdomen, which increase in intensity before the menstruation and the sexual contact. We call this condition dyspareunia. Colposcopic findings. Dark red or cyanotic limited a little bit prominent formation of a various size and shape. So you can see endometrial foci over the ectocervix, and it's a firm, a little bit prominent cyanotic formation. Also in these pictures, we can see also one endometrial implant. And this also cervix, as if we will have a close look, we will see that is pathologically changed cervix, and we can see the area of dysplasia over the ectocervix. And we slowly came to dysplasia. What is dysplasia? Dysplasia characterizes by significant proliferation of atypical epithelium of the cervix with disintegration of its layers, but without involvement of stroma and superficial epithelium. Dysplasia is the most common type of morphological precancer of the cervix. The incidence of the transformation of dysplasia into the carcinoma in situ is about 40 to 64%. 15% of patients experience transformation of dysplasia into the microcarcinoma. Depending the intensity of cellular proliferation and the severity of structural atypia in the epithelial layer, there are mild, moderate, and severe dysplasia, or we call it cervical intraepithelial lesion or neoplasia, and we term it like zin 1, zin 2, and zin 3 relatively. It's a picture of the cervix, and we can see different pathological processes. Its appearance of the normal cervix, without any pathological condition. It's a low-grade sin. It's a low-grade sin means the matches to the mild dysplasia. High-grade sin, it's a severe dysplasia, and this may develop to the cervical cancer. And in this slide, we can see the transformation, pathological transformation of the stratified epithelium, which affected by the papillomavirus. And here it's a normal structure of the cervix epithelium. Here we can see disintegration of the cells and pathological changes of these cells. And this picture is matching to the low seal. In this picture, we can see all the pathologically changed cells starting from the parabasal layer. And we can see the pathological changes of the superficial or squamous cells of the surface epithelium. And of course, cervical cancer, all the layers of epithelium are affected. Mild dysplasia, or CIN1, it's a hyperplasia of the basal and parabasal layers, cellular and nuclear polymorphism, violation of the mitotic activity, cells of the intermediate and superficial layers of the stratified squamous epithelium without pathological condition. Let's return this one. is the mild dysplasia. And we see the superficial layer is without any changes. But in high seal is already pathologically transformed epithelium. Moderate degree of dysplasia or CIN2 characterizes with impairment of the cervical squamous epithelium within the 1/3, 2/3 of the depth. Along with the pathologically transformed cells, there are normal cells that are characteristic for the intermediate and superficial layers. At severe dysplasia, hyperplastic cells of the basal and parabasal layers replace normal cells within the 2/3 of the epithelium of ectocervix. Dysplasia may occur with the further progression of the changes or stabilization of the process or its regression. And we cannot find the exact reason why in some patients it's progress very fast. In some patient we observe the stabilization of this process, and some patient they experience total regression of this pathological process. We cannot explain this phenomena. Epithelial dysplasia can be observed on the visually normal cervix, but more often it develops on the background of different pathological processes, different inflammatory processes of the vagina and the cervix, especially as a result of sexually transmitted infections. Again, we can see cervix with mild dysplasia. It looks like this one. Moderate dysplasia, the most part of cervix is affected, and severe dysplasia, or maybe it's the presentation of cervical cancer. We can see disintegration of the blood vessels and spread extent of the pathological process over the whole ectocervix. Colposcopic signs of dysplasia: a typical transformation zone, papillary or lumpy leukoplakia, area of mosaic and iodine negative zones. It's a cervical tissue or ectocervix, cervical surface with mosaic. It's one mosaic and punctation. These are two main clinical, not clinical, it's imaginary signs of dysplasia. Colposcopy helps to detect pathologically changed areas for the punch biopsy with the further histological examination of the obtained material. We make the iodine test and we color all the ectocervix by the Lugol solution, and as the normal cervical cells tissue, which is rich with glycogen, it's colored by the Lugol solution to the dark brown color. But pathological areas which are poor with glycogen, they remain uncolored, and they have the appearance of the pale yellow spots on the totally colored dark brown cervix. And that's why this probe is very easy and it's directed to the punch biopsy. We can make the differentiation of the pathological areas from the normal healthy tissue of the cervix and take the punch biopsy exact from these pathologically transformed areas. Biopsy must be performed by scalpel because electroexcision damages tissue and comfortome gives no possibility for obtaining sufficient tissue for the assessment of the depth of invasion. Cervical cancer. is the second most common cancer in the women worldwide. The average increase in women with cervical cancer within the 2003-2013 years during the 10 years was 2.5% per year, with a prevalence of 116 cases per 100,000 of female population. At the same time, only 28% of patients are detected at an early stage, and more than 30% of newly diagnosed cases are in the third and fourth stages of the disease. It was confirmed that there is association between the cervical cancer of both squamous cell and glandular tissue with human papilloma virus. Ability to oncogenesis was confirmed for 14 of 200 types of human papillomavirus. At the same time, types 16 and 18 in total are responsible for more than 70% of cervical cancer in women all over the world. And the type 16 and 18, they are the most common contributors and types or papillomavirus to the cervical cancer. And according to the terminology of the College of American Pathologists, oncogenesis of cervical cancer starts with mild dysplasia, or it's matching to the low seal, which develops to the severe dysplasia or high seal, precancer, carcinoma in situ, and cervical cancer. So development of the cervical cancer before that, it passes through the stages of dysplasia, starting from the mild to severe forms. Process of malignization of the stratified squamous epithelium can be conditionally imagined as sequential progression of the structural impairment of the epithelial layer and cellular morphology in the following order. First stage is the proliferative changes of the epithelium that are physiological regenerator. After that, it's progressed into the thin or cervical intraepithelial lesion of the different degrees, starting from the mild to severe, pre-invasive cancer, carcinoma in situ, and invasive cancer. So all the process may be presented by the progress that pass through all these stages from the physiological changes, proliferative physiological changes, into the invasive cancer. On this slide, we can see the classification of the cervical cancer by T&M and FIGO systems in the stages of cervical cancer. It's the most popular classification of the cervical cancer by its stages. The treatment and prognosis. Treatment of cervical cancer includes impact on the initial tumor, and it may be surgical or radiological treatment, and areas of tumor dissemination. Surgical treatment is possible only at stage 1 and 2, before the dissemination of the tumor to the parametrial tissue, and it is conducted in a combination with radiotherapy. The depth of the invasion determines the probability of metastasis into the regional lymphatic nodes and cervical cancer relapse, what is considered while planning a radiotherapy. The prognosis of cervical cancer is defined by the stage of the disease. So at first stage, the 5-year survival rate is about 85 to 90% in both surgical and radiotherapy if the surgical operation is contraindicated. and it's a quite high rate, and that's why it is very important to diagnose the cervical cancer in the early stages, and for this purpose each woman must attend the gynecologist each 6 months or twice a year. At the first stage, 5-year survival rate is about 60%, at third stage 40%, and at fourth stage less than 10%. And as late the cervical cancer is diagnosed, the prognosis become poor. It's a uterus and the dissemination of the cervical cancer to the parametrial tissue. And we can see clearly the dissemination of the cancer cells to the pelvic nodes, lymph nodes, and para-aortic nodes. And during the surgical operation, it's very important to remove the parametrium with the total hysterectomy. It's very important, and the operation of choice is the Wertheim operation. It's a total abdominal hysterectomy with the parametrial tissue and lymphadenectomy. Diagnosis of cervical pathology. First of all, it's anamnesis and gynecological examination. Cytology is the method of early diagnosis of precancerous condition of the cervix and cervical cancer, and includes microscopic examination of the smear obtained from the cervical surface. The material is obtained from 3 areas: surface of the vaginal part of the cervix, cervical canal, and transformation zone. We call this pap test. It is the screen included to the screening of the cervical pathology. Liquid cytology, we obtain the material with the special brush, place it in the special liquid, and after that, place in the special equipment for the detection of pathologically changed cells. Colposcopy, it's additional method of examination, but doesn't include it to the screening program. Histological examination of the biopsy material obtained by scalpel incision. It is preserved into the 10% solution of formalin for the future investigation. Magnetic resonance imaging and positron emission tomography for the detection of the dissemination of the cervical cancer to the distant organs and tissues. Here we can see the special brush for the pap test. And the results of pap test were assessed by the special Bethesda system that was confirmed at 2001. And here it's a cytological classification of the cells, starting with atypical glandular cells and with the SIL or squamous intraepithelial lesions of different degree. What are the treatment principles? First of all, we should make the impact on the main links of the pathogenesis. Treatment should be complex and differential approach depending on the type, form, and variant of the pathological process. So each patient requires individual approach. Stages of treatment. At the first stage, it's heterotropic treatment. It's a using of different antiseptic, antibacterial therapy, or antiviral therapy to eliminate the contaminant. and pathogen. Second stage is the correction of violations of the vaginal environment. Third stage is the surgical intervention, and surgical intervention include local destruction, diatherm excision, cryotherapy, laser therapy, or chemical impact on the pathological areas, and radical surgical treatment that includes cervical excision, cervical amputation, and hysterectomy. One of the most common and most popular methods, and it's a really very effective method, it's a cryodestruction. What is this? This method is based on using of low temperature on the pathological changed areas, and the coolant agent is the nitrous oxide. Procedure is conducted at the first phase of menstrual cycle. The exposition is performed of 1 or 2 stages with the duration of each exposure from 3 to 8 to 10 minutes. Advantages of this method: it's a low trauma incidence, the procedure is painless, it doesn't require any anesthesiology or anesthetics, no bleeding, absence of sclerotic changes of the treated area, and deformation in tissues and organs. A method is very easy of use and it's very safe. We can see the appearance of the cervix. It's just before the treatment, and we can see very wide area of pathologically changed cervical tissue. This image is immediately after the cryotherapy. We can see whitish areas, treated areas, and examination of the cervix 4 months after treatment. And this cervix looks very healthy. And there is even no any traces of pathologically changed areas. Second method, also very effective method, it's a treatment with carbon dioxide laser. It's based on transformation of the tissue of the light energy into the heat energy, which destroys the pathological areas on the place of exposure by the method of coagulation or vaporization. Usually, equipment based on carbon dioxide, neodymium, holmium, and argon laser. It is possible to perform laser vaporization and conization. Advantages of this method: radicality, local exposure, minimal damage to the surrounding or underlying tissues, and as a consequence is absence of scar deformities and sufficient hemo and lymphostasis. This is cervix before the treatment with carbon dioxide laser and several weeks after treatment. Also, we can see the totally healed cervix without any pathological areas on the surface. Prevention. What kind of methods are available at the present time? At the present time, for the prevention of cervical cancer in adolescents and adults, the recombinant vaccines containing viral particles of N16 and 18 serotypes are used, but there is still no long-term observation practice of the vaccinated objects that exist. The most popular vaccines are cervarix. It's a bivalent vaccine. It protects against 2 types of human papillomavirus, type 16 and type 18. Vaccination produced from the age of 9 years. Gardasil, it's the next vaccine, Gardasil 4. It protects against 4 types of human papillomavirus, type 16 and type 18 as cervarix, and plus type 6 and type 11, which cause genital warts. Vaccination produced in girls and women from the age of 9 to 45 years, in boys from the age 9 to 26 years. Next vaccine is Gardasil 9, protects against 9 types of human papillomavirus, 6, 11, 16, 18 like Gardasil 4, and other types like 31, 33, 45, 52, 58, which also cause cervical cancer. Vaccination is produced from the age 9 to 26 years. Thank you for your attention.